Welcome. This is Lynn Varco with the Minnesota Alliance for Ethical Healthcare. Here with our guest today, Dara Baldwin with the Center for Disability Rights. She is going to be talking about disability justice, the pathway to equity in healthcare as part of the Minnesota Alliances for Ethical Healthcare's webinar series. You can learn more about the Alliance at ethicalcaremn.org. There's lots of great information and updates there. I want to share a little bit of background about our speaker. We're really honored to have her here. She has done path-breaking work in the area of disability advocacy, and I think this is going to be a really remarkable talk today. Dara Baldwin is the Director of National Policy for the Center for Disability Rights, CDR, which is an Alliance partner. It's a non-for-profit, community-based advocacy and service organization for people with all types of disabilities. CDR uses a peer model where people with disabilities show other people with disabilities how to live independently and advocate for themselves. The Center for Disability Rights is a unique fusion of advocacy and supportive services. Ms. Baldwin was a senior policy analyst at the National Disability Rights Network and an Americans with Disabilities Act compliance specialist in the DC government. She also served as a policy analyst at the National Council on Independent Living, where she engaged members to get involved in advocacy work to make change. In 2009 and 2010, Ms. Baldwin received the Presidential Citation Award for her work in the American Society for Public Administration. She serves as an associate member of the National Academy of Public Administration Standing Panel on Social Equity. She has been an adjunct professor at Bloomfield College. She holds a Bachelor of Arts in Political Science from Rutgers University and was a Pi Alpha Honors graduate with a Master's of Public Administration from Rutgers University School of Public Policy and Administration. The topic of today's conversation seminar webinar is Disability Justice, the Pathway to Equity in Healthcare. Ms. Baldwin will discuss disability justice and how using this framework in the implementation of social justice work creates policy and change that is centered in equity. She'll also provide a brief overview of the Center for Independent Living. She'll talk about the 31st anniversary of the Americans with Disabilities Act, ADA, this month, and what it means to oppose the legalization of assisted suicide in disability advocacy. So with that, I'll hand it over to Dara Baldwin. And after this presentation of maybe 20 minutes or so, we will have Q&A, so you can use that function at the bottom of your screen, and we'll make sure your questions get answered. With that, welcome, Dara Baldwin.
Thank you so much, Lynn. Thank you. And thank you to the Minnesota Alliance for Ethics. We're proud partners. Wonderful introduction. I always kind of pinch myself, like, who are they talking about? Okay. So yes, as Lynn said, I am Director of National Policy for the Center for Disability Rights. And power to the people. I have my Black Disabled Live shirt on. You can't see there. I want to make sure you saw that. Although my CIL, Center for Independent Living, our center is headquartered in Rochester, New York. My boss wanted a DC presence. There is this called the DC Beltway that also blocks people out, and he wanted to be in the conversation. So he hired me. So I live and work in Washington, DC. I have to say on everything I am, DC statehood, DC statehood, DC statehood. So I have to say that. So, and also want to say happy 31st anniversary to the ADA. So I'm going to go in the order in which, the description of this conversation is about. I've been doing disability policy for almost 12 years now, which I can't believe I'm saying that. I've been doing social justice policy all of my life. I come from Newark, New Jersey, where Rutgers, I went to school there. And, if you know Newark, it's a very political place. My parents were very political. My mom took buses to Selma for the Selma March and things like that. So I've always been around social justice my whole life. But disability work, 2009 is when I got started in early 2009. And that was disability rights. I am no longer doing disability rights. We at the center work from a framework of disability justice, and they are two different things. Disability justice centers Black, Indigenous people of color, and we have what's called 10 principles. The first principle being intersectionality. So we look at our work from a space of multi-marginalization, that disabled people are all things. You have an African-American trans woman who is a refugee, formerly incarcerated and disabled. They exist, they are out there. And when we fight for their rights, we have to fight for all of those things. And the 10th principle being collective liberation, that we also, in doing this work, whenever we liberate one piece, we have to liberate all, right? And we don't pit each other's plights against one another. In the disability rights community, you will not find that. They are center white folks, and they also do not do number 1 through number 10, and they have been very clear about that. And Black, Indigenous people of color who were disabled, who tried for years to work with the disability rights community, chose to move away and create their own space, and disability justice was born about 5 years ago now. And so that's where we come from. We also are trying to end racism and end systems of oppression. And so that's where we come from in the Center for Disability Rights and our work and what I do here in DC. And that is, right, talking from a social justice space. We are part of numerous coalitions, and in fact, promote the fact that disabled lives are just as important as any other lives. And it has not been even more clear after 2020 and the start of this pandemic. Many of you probably heard about what's called treatment rationing. We did have a couple of states who were doing that, who were deciding people's lives were not as important if they had a disability that they felt, you know, this person is not worth saving. We had some areas where people with disabilities who have been on oxygen all their lives and, you know, needed these things to live were told, we may take your oxygen from you because the community needs that oxygen and you don't need that anymore. So we had what's called treatment rationing going around this country. And then when the time came in 2021 for the distribution of the vaccine, many areas we had to fight, even here in Washington, DC. In the introduction, Lynn said how I ran the Office of Disability Rights. I ran the Human Services section under Mayor Gray when he was a mayor in 2013. It was interesting then, it's interesting now. We had to fight that with that office, with our own new mayor now, oh, so she's new now, to say that disabled people were essential. That, you know, here in DC, they decided, I think it was seniors, anyone over the age of 60 was getting the vaccine first, and people who were essential workers. And we had to fight and say, disabled people need to get this first. And it took us weeks, not days, weeks, to get that implemented. And it wasn't just in DC, that was around the country. The lack of people understanding and valuing disabled lives, even 31 years after the ADA, remains. And that's part of the history of disability. So I'll talk about that real quick. The ADA is 21 years old as of yesterday, signed July 26th by President George H. Bush. But many people forget that the ADA was the start. It was not the end, it was a compromise. The ADA is a civil right, and it is not based on doors and ramps. That is a part of it. Really, the premise of the ADA was and is community integration. So in 1876, San Francisco created what's called the Ugly Laws, the first Ugly Laws. And what the Ugly Laws said basically was that people with disabilities are not allowed to be in public spaces. Those laws took off like wildfire and went around the world. There are still countries that have the Ugly Laws, specifically in Eastern Europe, Russia, those areas still have the Ugly Laws. And later on in the United States, moving towards the 19th century, the 20th century, moving out of the 18th century, 1876, out of the 19th century into the 20th century. FDR, even though he was a person with disability, but hid his disability, appropriated that even more so in his New Deal. That's why many of us who do this work find nothing about the New Deal to be helpful to our people. The New Deal was racist and ableist. What he did was he took that concept of ugly laws and people of disabilities not allowed being in public, which meant they weren't going to school, they weren't, you know, going to parks or recreation or carnivals or any of those things. He created institutionalization within the New Deal. And that's why you got institutionalized people. And that's why most people with disabilities, then when they were born, especially if you could tell at their birth, they were put directly into institutions. And most people with disabilities were in institutions for most of the 1900s until later in the 1970s, when a group of mostly white women got together and said, no, you're not going to do this to our children. Madeline Will was one of those women who pushed forward and got a lot of laws changed and said, no, I'm not putting my child in an institution, and they're going to be educated. And they started the IDEA, the Individuals with Disabilities Education Act, 1970s, and started saying, no, disabled people should be in the public. They should be with us, and they should have those rights. So, you know, 64, when they did civil rights, they weren't in there. They did aging rights. They did pregnancy rights. People pregnant have rights, right? Women pregnancy. And then they did the disabilities. So the Americans with Disabilities Act basically said community integration, that get those people out of those institutions and into the community. Then in 1995, you had what's called the Supreme Court case, Olmstead v. Lois Curtis. Now the disability rights community will only uplift Olmstead, who was the white man who kept them in institutions. But Lois Curtis was a Black woman. And she is still very much alive and lives in Georgia. And she fought to get herself out of the institution. And what that Supreme Court case said was, in the ADA Title II says that she has a civil and human right, and that she should be able to get out. And the Supreme Court says she is correct, and you states need to provide the services so that she can live the life she needs to live. So the ADA was a compromise. It wasn't finished, because we all know we have a number of Olmstead v. Lois Curtis cases around the country, and we have people who are still in institutions on waiting lists. Here in DC, we have a 12-year waiting list. There's several things around that, the services that aren't provided. And then we also have what's called a lack of accessible housing in this country. 31 years after the ADA, only 3% of the housing stock in this country is accessible. 3%. So we still have a lot of work to do, but we also celebrate the fact that a civil and human rights law was passed to give disabled people civil and human rights. So they've only had it for 31 years. Understand and know that means that disabled people were not allowed to vote until 1990. Like, a lot of people don't understand like what that means to disabled people, and specifically Black, Indigenous people of color who are disabled, who are double any of the statute here, double it for Black, Indigenous, for Black and people of color, and triple it for Indigenous. So even the unemployment rates for disabled people before 2020 were double digits, high 10, 11%. Now it's up to 16, 18% as of February 2021. And so those are what we're still fighting, right? Is making sure that disabled people, and we at the CILs, the Centers for Independent Living, which are CILs, you have to buy through the Rehab Act of 1973, Section 702 is where you'll see Centers for Independent Living written and what they are. 50% of their board must be disabled people, 51%, and 51% of their employees must be disabled people, right? So they're centers led and run by and for disabled people. And cross disabilities. So we cover everyone from blind, low vision, deaf, hard of hearing, developmental disabilities, physical disabilities, mental health. We cover everyone at the CILs. And there must be one in every state, but most states have multiples, like Minnesota has multiple CILs throughout the state. And you can go to the ILRU, which is the Independent Living Research Utilization section. They do all kind of research around our work. They have a directory with a map. Click on the map, click on Minnesota, click on Michigan, wherever you are, and it will come up. The CILs will come up. You'll see by the address where your CIL is. Please use them. They are non-residential centers where people with disabilities go for services, for fellowship, for any kind of information that they need around their jobs or housing, and also advocacy. That is part of the 5 core principles of the CILs, because you can't fight, you can't, you get it right, you have to keep fighting for it. And so as in my cell, the Center for Disability Rights, I have a team who's in Albany and they fight for the New York state rights. And then my boss wanted me here in DC fighting on a federal level for the rights of disabled people. And so that's where the CILs are. And when I say fellowships, so you understand and know, we get a lot of people out of institutions, thank God. And when they come out, they're isolated. A lot of people don't talk to their disabled neighbors. They don't know their friends and things. And so our CILs are places where they can come and go for poetry night. We have a garden, that they have. It's an accessible garden. The beds are up for people in wheelchairs. We have a summer camp for our disabled children because a lot of disabled youth don't go to regular summer school or summer camps because people don't offer that. They don't have accessible camps for them or camps that understand their disabilities. So we have summer camps. We have adaptive sports played in our CIL. My CIL is very large. We're one of the largest ones in the country. But we have adaptable equipment for exercising and things like that. And so that's fellowship, right? And they get to interact with people because that is part of being community and community integration. And that is also part of valuing disabled people. And the fact that, right, those poetry slam nights are run by the deaf community or run by those who are blind. It's run by them. And so we value them, we value their talents, we value their life. And so that's what the CILs do around the country. Finally, I'll talk about advocating against assisted suicide. We at the Center for Disability Rights, CDR, are proud to house, not dead yet, Diane and her crew is there. Diane is a part of our board. And ending the thought that assisted suicide is something that is part of valuing disabled lives. It is not. You hear the fight, hear the counterpart to this about, if you get in an accident and you can't do the things you used to do and your life is not valuable anymore, and assisted suicide is a way out. And we don't believe in that. As I was saying earlier, through everything I talked about, is that we value disabled lives. No matter what disability you have, we believe you can and should live in the community because of the ADA, because of civil and human rights. You just need some type of services or some type of assistance to help you in your life. Everybody needs that. Now, I am not a person with a disability, so that's why I say they and speak that way. They tell me I'm part of the family because I've been doing it for so long. I'm fine with that. But the one thing, if you don't take anything else from this, is the fact that we believe, and I believe, there's nothing wrong with having a disability. And I say that with confidence, 100% confidence. And people look at me when I say that, like, how can you believe that? My grandfather, my mother's father, just 2 generations ago, was told he was not valued. Was told he was not really 100% a person. Was told at 8th grade, you can't go any further in education. He never got anything past the 8th grade education. Was told that, as a Black man, you're not valued in this country. And that's not true. Even though he only had an 8th grade graduation, education, he accomplished much in his life, owned property, did things around the country, and raised 3 children who all went to college, all got their master's degrees, right? And so here we are. When you tell me that, I don't believe that disabled people are not worthy of all of these things and cannot accomplish all of those things, right? Black people told us for years, and here we had a Black man be president of the United States. Now we have a Black woman who is vice president of the United States. It's the same thing about disabled people. And until you actually talk to them and are around them, and I really implore you to reach out to your CIL. Go and visit the CIL. The CILs also, usually most CILs have what's called a conference room or a large room where they have conversations with people who they say, come in and talk to us about your program, or come in and learn about us and our programs and who we are. They do all kinds of education, how to build build things and make it accessible. They usually have a durable medical equipment closet. So if you have clients or patients who need something, we usually have those. So I would say that, right? And the only way to get to know a community is to interact with that community. And we really strongly push that forward. That will also give you some understanding around the value of life and why we are so against assisted suicide. The fact that you're telling someone to end their life because of so-called, it was over anyway, and the way in which you are living is not quote unquote human. It's very disrespectful. It's very disheartening. As I just told you about what the ADA is, the ADA, Americans with Disabilities Act, what the IDEA, right? What people did and created the ugly laws in 1876 that still resonate through everything we do. Because no matter what program I talk about or I try to work with people, right? Look at the bike programs. If you have biking in your city or your area, you see you can get on a bike and ride it. And I had it here in DC when I was in charge. One of the reasons I had to leave the department was because they never listened. The Department of Transportation was in charge of it, sent me the project. And I said, no, you can't do this. You're leaving out disabled people. And they were like, well, why would disabled people need these bikes? Disabled people ride tricycles and hand bikes, and you should offer that. And they were like, no, we're not doing that. It violated the ADA because they were receiving federal and state and DC funds. And it violated the fact that you create, in Title II, the ADA says, if you create a program for one person, you have to create it for all. And so you left out that community purposely, as if they weren't needed. It's always asked, well, how many disabled people will need it? And the reason it's asked is because back to those 1876 laws, they weren't considered to be in the public. So whenever people keep thinking about programs and things, they don't think about this community as human. They don't think about this community as part of the public. And it is harmful to our work. And that is what is resonating in these assisted suicide bills and laws that are trying to be passed, is the fact that being disabled means that you're inhuman. And again, it's disrespectful. It's harmful to the work, and it's harmful to an entire community. And I will finally say, if you live long enough in this country, in this world, you probably will end up as a disabled person because of just living your life and the way in which our bodies are made. And also you wake up one day and you are a healthy, person without a disability, and something happens to you where you are a person with a disability. If COVID hasn't shown that to us, right? And now the COVID affects people who have had COVID and are now trying to live their life the way they lived before and are not doing that because of disabilities that have come on, an onset, that's called an onset disability from their having COVID. I have actually two friends who walked out of their house one day, was going to work, and both of them at the end of the day were no longer able to walk. One got hit by a bus trying to cross the street, and another was involved in a shooting that had nothing to do with her. But she was shot and she's paralyzed from her waist down. So you need to understand and know about disabilities and what it is in life, because it is a part of all of our lives. And again, I want to thank Lynn and the Minnesota Alliance for Ethics. I hope I've given you things to think about. I will give Lynn some resources for you to read. Unfortunately, there are a lot of books about disability rights, but they're all written from a white perspective, as well as movies that are all from a white perspective, but we are working on that. We have some Black scholars who are working on writing some books about Black, Indigenous people of color who helped out with the disability rights movement.
Dara, thank you so much for that presentation. We do have some questions here, so we'll get to those. I thought you did a really great job outlining some endemic biases and prejudices in our society, within the healthcare system in particular, that affect people with disabilities. Can you talk a little bit more about how disability advocacy, and then by extension, disability justice, intersect with opposition to assisted suicide? I know you talked a little bit about that, but maybe unpack that a little bit more for our audience that is less familiar with how you do disability justice work.
So systems of oppression, right? If you're oppressing someone and telling someone they are not viable in this community, their thoughts and their life is not valued in this community, or any type, wherever they are, their station in life is not valued. That is what assisted suicide is saying. You know, you might as well end your life because you're not living the life you led, and it was so beautiful and everything before because you did not have these disabilities. Those are systems of oppression. That's oppressing someone, that because they no longer walk the same as they walked, or they may not even be able to swallow. We have people, right, who were able to swallow and eat the way they used to before. Now they have to eat different ways. That is the key to medical technology, is that there are things that are allowing this person to swallow and to eat in a different way. No matter what stage you are in life, you are valued. That is a value. That is not something to tell someone, end your life and it's over because you can't be the vibrant, athletic person you were before. And so that's a system of oppression. And that's where disability justice, that's where we come in, about ending systems of oppression, right? And I feel that's how we address that situation, is that telling someone assisted suicide is not the way to do it. Instead, how about assisted living? How about tell them how to live your life in a new way? None of us, from the time we were born, lived the same way we lived a year ago. We right now do not live the way we did a year ago, right? Or 2 years. How about 2019? July 2019, you wouldn't be able to get me on this phone, honey. I'd be out enjoying, right? Everything. But now we have COVID, right? And you're more careful. Yes, you're going out, but it's not like it was before. We may never be the same as we were before COVID. And so life changes all the time. Your situation changes all the time. People right now, you may have a roof over your head. In a couple of months, you may be unhoused. That doesn't devalue your life. That doesn't devalue who you are as a person. It just changed the state, your station in life and where you were. And so those are the same kind of things. Instead of telling someone to end their life, why don't you tell them how to live their life in a better way, in a way in which we as CILs and Centers for Independent Living can show you how that is done with humanity, with civil and human rights, and with love and care.
Yeah, I really see that in a lot of the work that we do with our various alliance partners and the advocacy work we do here in Minnesota. We have a question related to what you said about how, I thought it was a really great point, about how all of us at some point, maybe near the end of our lives, will be people with a disability or disabilities. I think that's a really salient point. And so the question has to do with, how do we, with that in mind, how do we help other disability organizations or healthcare organizations who might not see that connection that you're just talking about there, and also might not see the connection between supporting disability justice and opposition to physician-assisted suicide? What are maybe different ways that we can help like-minded organizations who may not be with us on this issue understand it a little bit better?
Sure. So always resources. And like I said, I'll send them to you, but you can Google disability justice. If you Google it, the SIN project will come up, SIN. And they are the ones who did the work around creating disability justice and centering. So you'll see that and how that work is manifested, and we push it forward. You can do that. As I said, you can find your CILs at the ILRU directory. I really strongly suggest you create a relationship with the CIL. Take a tour. They do offer tours, right? They also have people who come out to your organizations and will talk to your community, just like I just did this conversation, but on a, another level of, intimate conversations with your board, intimate conversations with your members, so that they can learn and know about the ADA. There are plenty of different organizations around the country who have members. Like we consider ourselves sister CILs, brother CILs, or we're all members with each other, who will also show you different ways in which disabled people live their lives. So we also have like sisterships with the Paralympians. I just came back from New York. I work with the United Nations, right, about how this looks on an international level. So I work with the Paralympics. I have a whole group around. There are a lot of Paralympians who don't want to go to Tokyo because they have underlying conditions, right? And we're trying to help and work out with that and see what that looks like for them. So you have a lot of athletes. Like I said, adaptive sports is really big in disabilities. You have people who are doing music and hip hop and all of these things. I don't know, I'm not a hip hop person or even a concert person, but about 8 years ago now, Leroy Moore is the person who really does this, and you can find Leroy on Twitter. But he reached out to a lot of these rock bands, a lot of these people who do concerts, and now they have ASL interpreters. I don't know if you know Pink, when she did the Grammys a couple of years ago, she was not only flying through the air, she had an ASL interpreter on the stage with her at the Grammys, and people were like, what is that? Oh, this is amazing. Because some deaf people can hear the vibrations of music. Some people are hard of hearing and then not only do deaf and hard of hearing people use sign language, a lot of the developmentally disabled people or people who are nonverbal use sign language. And so they go to concerts, and she really embraced it and has a sign, when she goes back on tour, she'll have sign language interpreters with her. Mayor Bloomberg, he was the first mayor in the country to have an ASL interpreter. We had to sit down with him and explain to him why it was important. You would think here DC would, because we have the most deaf people in the country because of Gallaudet University. They graduate, they stay here, but we couldn't get our mayor to do it. But anyway, once you're around disabled people, you will understand the value of their life and how important it is, and how to interact with them. It's the same, I'm not LGBTQ either. They also say I'm part of the family. I was like, I don't understand this. Explain to me what non-binary is. And I just went and I learned, right? And I'm always around that community. Pride Month, I'm there outside of Pride Month. And I learned about what it means to be LGBTQ and what that does to the community and society when we harm them. I'm not a refugee or an immigrant, although I was not born in this country. My father was serving his country, so it's different. But I went and I learned and I talked to immigrants in the refugee community, and I work on refugee immigrant policy. I feel that's the only way you can learn something, is if you immerse yourself in it. This community is I have never heard, every time I tell someone to go to a SIL, I've never heard someone say, well, the SIL said don't come here. They don't do that. They are more than happy for you to come and have more resources than you can think of to help you with your messaging and getting information out.
Great. We have a few more questions here, kind of one along the same line as the previous one. So in Minnesota, a lot of the advocates for physician-assisted suicide are usually, not necessarily always, but usually the question says politically progressive. So how do we get those advocates to understand that this is a disability justice or disability rights issue? So again, the person, I'm just asking the question here, the person in Minnesota, the author of the bill, one of the authors is a registered nurse. So the question is, how do we get them to change their mind?
Very good question. First, I'll say if I had that answer, I would be like like nobody would. I wouldn't have a job. No, I'm only kidding. It's constant conversations and constant education, and all politics is local. Let's remember that. And all politics is relationship. If I were you, I would take those members of your state legislation to the SIL, right? Or bring the SIL to them, to their office, and say, here, let us talk to you. A lot of specifically progressives is real interesting. I even hate that word, but people who think of themselves as progressives don't ever want to talk to foe. It's the worst way to do this work. I talk to foe all the time. Like, I'd rather talk to foe than friends, because friends already know. I'm like, yeah, I'm singing to the choir. Nope, I need to have a conversation with foe. And it's not going to take one conversation. It takes multiple conversations. It also takes data and analysis and information, which we have. We can give you data showing you how people with disabilities live their life and live it very well. So those kinds of things, and be consistent about your message to them, right? And the fact of what we, like I was saying, messaging is, the ADA is about community integration and about civil and human rights. Be consistent. It's the same thing when, you know, weapons of mass destruction, weapons of mass destruction, just keep saying the same thing over and over again, and people believe you, right? It's just like, that is the same messaging that those people use. We need to start understanding and knowing. Saying the same thing over and over and over again from different places and different voices really does work with people's mental and their minds. Having that messaging in your pamphlets, in your, like, start it off with, the ADA is a civil and human rights. It is about community integration. It is about the humanity of disabled people's lives. Boom, put that on everything you send out. It just constantly comes. And they kind of, you know, they'll, not all, because people are who they are, but some people will change. Make sure those staffers who work for those legislators are there when you have those conversations, because it's really the staffers who do, like, the real work. Let's be real here. So make sure those staffers know. And when people are running, I tell people this all the time, register to vote and vote every time. It is imperative. And that when you're looking at candidates, that candidates are including this in their decision making, that it is part of their platform. Because if it's not part of their platform before they get into that office, it never will be. And so push that and say, listen here, you're going to run in my town, my county. You need to understand and know that disabled people, right, are human beings. And this is why. And let us have this conversation with you. And that this language should show up on your platform, on everything you do. You know, making sure that your meetings and the things you do are accessible. That means you value disabled people coming, that you pick a place that has an accessible entrance, an accessible pathway of travel, meaning to get to where you're having the event, meaning that there's a accessible bathroom in the facility you're going in, meaning that if it's on the second floor, that there's an elevator to take people to the second floor, right? Like, all of those values and what you do as advocates resonate to the people you're trying to change their mind. Because if you don't do that, right, that's called integrity. That's called having, right? I mean, if once you move away from that message and one thing, that's when they have you. It's the same thing we do on the other side, right? Weapons of mass destruction. And we were like, okay, show us the weapons of mass. You didn't have, like, once you can nix one thing from the message, you're moving it forward. But be consistent in your message, be honest in your message. And sometimes, and the other last thing I'll say is, have disabled people lead your message. Make them lead the organization.
Yeah, thank you for that. Really nicely encapsulates what we've seen in Minnesota. We have some really strong people with disabilities advocating for us here in Minnesota. And we also stress the importance, especially at the state level, of developing relationships with state legislators, which you're also talking about, and letting them understand the granularity of this issue. I don't think people get up every morning with their cornflakes thinking about assisted suicide or disability justice, for that matter. And so it takes some unpacking. It takes time for people of goodwill who may not understand the issue fully. And so I think what you're talking about is exactly what we're trying to do, and really focus on getting people out, talking to their legislators, and developing those strong relationships. Our next question here is about whether or not you and the Center for Disability Rights assist families that have children born with disabilities, and how you advise mothers who are told that their preborn child may have a disability, whether that enters into your nexus of work, and how that maybe affected the lens through which you do your work.
So yes, thank you for the question. And we do reproductive justice, and we come from the reproductive justice side of it. Again, which is a Black-led lens. So one, you asked, do we assist families? Yes, we do. We assist families who have children born with disabilities. Again, especially if the child is born and you know, like if they have Down syndrome, those are disabilities you know immediately when they're born. Sometimes you don't know so late, you know, they're 2 or 3 years old if they have autism or some other. And usually most doctors, not all, most clinicians know to contact the CIL. Sometimes they do, they don't. There's also what's called a network of disabled communities, and they'll get you in contact. But we will assist families, like if they need, like I said, durable medical equipment, like if you need crutches or something for your child, and especially for children, because they grow. Right. And so they grow out of the crutches, and we literally have a closet. Most sills I've been to, and I've been to a lot, and Minnesota has some great sills. I've been to Minneapolis many times and other areas, St. Paul's and everything. They have a closet where those families, you know, the 2-year-old grew out of those crutches, and they'll give it and they donate to the other, right? So the families don't have to pay a lot, because durable medical equipment can be very expensive. Or they have wheelchairs that are smaller, and the child grows up, and we switch them out. And then, you know, now the child's 14 and they get another wheelchair. So they do programs. That's what I was saying, fellowship, right? That's fellowshipping, right? Knowing the children. As I was saying, I've been to a lot of SILs that have summer camps for children, usually from the age of 5, you know, they need to, like, for school, kindergarten, all the way up through high school. And even those high school students will be, like, you know, counselor assistants. So we show them, so they learn skills and stuff about working with people. So they usually have a camp. They usually have some kind of activity in the backyard. It's usually the back of it. They have some basketball, tennis, something going on for the children and the families. Now, the question around abortion and stuff, we, you know, in the disability justice community, we believe that all life is important, but we also believe in a woman's choice, and that is up to that woman. We do not support telling people, you know, because you have a disabled child. So we don't support that at all. We do support choice. And what we've really seen this in other countries, but we do see here in the United States. What I tell people is what a family does with their family is their business, right? When it becomes a problem to us is when the state and when the government steps in and says, you need to do this to this child. And I'll give you an example so people know. In Poland, which I've worked with Poland since 2009, we work with these families. In fact, so I started in 2009, and I know people remember 2010, the Polish president and his whole health ministry died in that plane crash. It went down, and all the people I worked with were in that plane crash. Like, all the work, you know, besides it was tragic, but we were doing a lot of good work about changing the mindset of people in Poland, because they have the ugly laws around children and going to school and all of those things. But anyway, he perished and died. It was really tragic. And I'll never forget the day I got the call, and I was like, oh my God. But anyway, in Poland, they've also created a genetics kind of they claim cleansing of the genes, where they can see they will never have any more people born with disabilities. That's their goal, literally written right in the government. And we're like, no, like, if a family chooses to do that, I'm not going to tell a mother, a father, family, nope, you can't do that. But what I am going to tell the Polish government is, oh no, you can't set up a program that does this. So we're against those kind of, the same thing in the United States. So it's the same kind of thing, you know, what people do with their bodies and their lives, we tell them no. And if there's a mother who has a question or concern, send them to the cell. Because I do think that parents need to see, yes, you may have a child with a disability, and this is a life they can live. This is how they will live. These are the tools we have so that they can live, they can go to school and be educated. Now we have, right, they can not only be educated in elementary and secondary, they can go to college. I got plenty of disabled friends who have master's degrees, who are doctors and lawyers and architects and engineers, and they need to see that. So because that's the other part of it, right? Like assisted suicide is that thing. The other side is, oh, you're gonna have this baby, and that baby will have a horrible life. Not really. If you do it right and you have a community around you who knows and understands this, you'll be all right. You and your child will be all right. And we suggest that. I strongly suggest that you send them to a SIL and say, here, look at how this community is thriving. And like I said, through love and care.
Yeah, thank you for that answer. I think the individual autonomy arguments that you bring up on the other side can be really pernicious. And our view at the Alliance is that by upholding the choices of a few on assisted suicide, we're going to put healthcare in jeopardy for everybody. And I think you've talked about that nicely here today. A final question we have is about how, we've talked about this a little bit, but whether or not you or others with your organization have had conversations with other organizations that support assisted suicide. And if you have any particular advice about how to engage actual organizations that are advocating on the other side of this.
So yeah, so I think it's Nancy's question and compassionate choice. Yes. To
Yeah.
answer your question, yep, I've talked to compassionate choices multiple times, as I told you, not just one time. So they're also members of like coalitions that we're part of, Leadership Conference on Civil and Human. This group I'm in now is not, but a group I was in before was part of Leadership Conference on Civil and Human Rights, and they're in that space. There is also like this Medicaid Can Survive or Medicaid something. They're in those coalitions, right? Just like all of us. And that's what I was saying. You know, I sit a lot of times at table with folks. So the other side is, what is their response? Usually when people get caught out there and they don't have a, like when we sit down, like I just laid it out to you about the value of life and they usually have no response at all. Their mouths are sitting there like, oh. Second, we'll get back to you with some data and some information that really negates what you're saying. And I never hear from them again. Or third, anger. Right? This whole, you're wrong, you don't know what you're talking about. And let me just say to you, as a Black woman, you see me, I am a Black woman. Do you know how many years we were telling people that police officers kill our people and that police officers and law enforcement is bad for our community? So right now, all of a sudden, people are like, oh my gosh, I said, how long we've been telling systemic racism exists in everything we do. So for years, right, 20, 30 years, people been like, I've been doing this for 20 some years. Like, okay, we've been telling you this. It takes a lot of patience. It takes a lot of, as I said before, be consistent with your message. Whenever they confront me, I've been actually been on a panel with, right, to, you know, what's the good and the bad versus, you know, what assisted suicide versus the right. I've been on panels. I've been in on the Hill at briefings. Oh, sorry, on the Hill here is Congress, United States Congress. That's a DC term. In Congress at a briefing, right, where, you know, they pose a question to you and I never change what I say to them the ADA is a human, civil and human right. It is these things and they can't get through that barrier, right? It frustrates them. But I know people want to say like, oh my gosh, I wish they would just go away. Listen, the enemy is going to be there. Like, hello, you know how many of us say, oh my God, I just wish law enforcement would just go away. It's not going to happen tomorrow. Or then I just wish people would listen to me and hear what I have to say. In this fight and in this conversation that we're having, they are not important. That is the other thing you must make them understand and know. You're here. You are a piece of this battle, just as we are. The important people are the decision makers. See, they take you, these compassionate, they will take your energy on trying to end them and dismantle them. And they're not the problem. That's not it. It is the decision maker who we were just talking about, the legislators. They are the important people. These other groups who are are not even secondary, right? You know who's secondary? The people you're fighting for. Primary are the decision makers. Secondary are your people you're fighting for. Tertiary is the whole entire community. That's what social is everybody. Justice is about. And those people who are our foes, they might fall at number 5 or 6 for me. You're not important to me. Who is important to me are the people right here. These people, that's the other thing, because that if you haven't, you should. I don't like war, but read The Art of War. Read the book and read about what it is to be in battle. I don't like war, but I've read battle books because I understand and know that I am in a war. And I needed to know. Read Patton. I'm a reader, so people look at me. I don't watch TV. I watch C-SPAN. My TV's on C-SPAN, right? My friends laugh. They're like, they talk to me about some show, and I'm like, I don't watch that. I'm reading a book. I read about war, and I read about battles of war because I'm in a war. And what I have learned from really generals who I can't stand, it's horrible, but what they have told you is go straight. And eye on the prize is really ableist thing. I always say, keep your heart on the horizon, right? Everybody has a heart, but be focused on who is your enemy. It is not them, because people are going to talk all the time. You know how many people tell Black people they're not worthy of anything? I don't spend my time on worrying about that person. I spend my time on worrying about the decision maker who's going to make sure that they know, right? The policies you make, it better have some worthiness and equity for me and my people.
Yeah, thank you for that answer. I think, again, that nicely encapsulates what we talked about earlier about building strong relationships with legislators and other decision makers. And thank you to Dara for a remarkable presentation. I think it highlights the differing approaches to physician-assisted suicide in our Alliance Coalition and all the different ways that different groups approach it. And we're grateful for your presentation today, and look forward to you and the Center for Disability Rights continuing your involvement on this very important issue. We're going to put a slide up here that will show anybody on the webinar how to join as Alliance partner like the Center for Disability Rights. It's really easy to do. You can go to our website to become an Alliance partner at ethicalcaremn.org/join us with a hyphen. You can see there on your screen. Takes about 15 seconds or so to fill out the information, and you will then receive updates and other information about what is happening on this issue of assisted suicide and other activities that we are advocating for here in Minnesota. So with that, Dara, thank you again. Enjoy the rest of the summer, and we'll talk again in the future. Thank you everyone for listening, and you'll be able to view this webinar and others on our YouTube channel. You can find at the Minnesota Alliance for Ethical Healthcare on YouTube. Thank you very much.
Thank you.
Thank you.
Power to the people.